maybe even the first 2 or 3 days of work, when we didn't know what we were doing, we realized that our host had no idea what he wanted from us or who we are or why we came. And we were still meshing as a working team. So I think that was probably not hard, but just more challenging, had some obstacles in there.
Our team spent 3 weeks in Uganda working for a small, for-profit clinic called Kampala Family Clinic. The clinic was founded in 2004 by 2 Ugandan entrepreneurs, Dr. David Nadwala and his business partner Samuel Kikomiko. Their mission was to provide quality, affordable healthcare to the growing middle class in Kampala. In 5 years, it has grown exponentially to serving over 10,000 patients. They now wanted to take the clinic to the next level, and that's where our team came in, to help them prepare for growth.
We were all quite anxious to get to work, but it took us a little time to adjust to the Ugandan culture and the pace of doing business.
While we're waiting for a meeting that we're supposed to have at 10, however it's 9:52. I don't know, we're trying to get used to how things work here. Apparently it's a little bit more low-key.
One by one.
We've been hearing about how bad Kampala traffic is, so anytime we have a meeting, we usually leave an hour and a half before, and we arrive at our location in about 15 minutes, and then we just walk around. So we decided, maybe yesterday or the day before, that traffic in Kampala is actually not that bad. But I'm happy to say we have finally discovered for ourselves what everyone is talking about. We were getting a little bit frustrated about the direction of the project, and maybe a couple team members clashed a little in an intense moment. I think the good thing about our team is that's okay. It's better to just say what you're thinking, and you can only improve from there.
After a week of hectic meetings and dealing with a lack of structure in the project, it was time for a break.
A turning point came in our trip when we went to visit SAS Clinic when conducting some market research. We met the impressive Dr. Grace, who discussed the strategic plan of the clinic and inspired us to narrow our focus at KFC. At that moment, we realized the power of our MBA.
So I was also very motivated by the meeting we had at SAS. They seem to have all these business principles integrated into their operations. It goes to show you that, even though we're so far away from where these theories are developed, they seem to be very effective, and so we're just going to try to implement some of them at our clinic as well.
And can you describe in some detail what some of the issues with the data are, or the search for the data?
Lots of issues.
Lots of issues.
Not tons. It's just really, really frustrating because getting data should be such a simple task if we were just given access. And we've had some huge problems doing that since we've arrived. So something that should take us a few hours has taken us about 3 days just chasing data. Hopefully it works out, but I just did not anticipate this issue.
Despite these challenges, we found innovative ways to gather information and huddled up to analyze it.
But in Africa here, you just go and buy the drug and you take.
So you save some money by not going to the doctor.
Sometimes if we don't have enough money, you can even use our local hubs.
Hubs?
Yes.
What do you mean?
Local hubs.
Yeah.
We have local hubs here.
For what's a hub?
Like Moringa, we have aloe vera.
Is it government clinics?
No. These are all for local people.
In a health insurance, you pay upfront, you're going to pay out over the course of the year, because that's how it works. People simply, what they are addressing is not so much the risk as the timing of the payment. That is not recognized by regulators who control the compliance cost of people like us who try and focus on bringing down the cost of access.
I think we're getting a lot of good information. We just need to figure out what to do with it. So,
As part of our market research, we visited Malago Hospital, the main referral hospital in the whole country. We met with Dr. Joel, one of the 6 neurosurgeons in all of Uganda, and he spoke about some of the management issues he faces.
I believe that getting good management will actually make clinical service better and will help us in ensuring that we can look after our patients. There is a lot that management could do for us. The biggest problem we have in the hospital is not just manpower, it's not just supplies, it is actually management. It is getting the little resources that we have, budgeting them well and utilizing them well. So I think if we could get input in management, we'll be able to solve maybe 50 even more % of the problems that we actually have.
And then when we went to a place like Malago, which is government funded, great doctors, and catering to people that are really, really poor. They rely a lot on government money as well as donations. And so some of the equipment that they have, or actually most of the equipment they have, is donated. But one thing I didn't realize, and I think many people who donate these machines don't realize, is the lack of technical support that exists within the country. So most of these machines have been broken for months, even years, because once they break down, there's no one there to really fix them. And one actually kind of sad story that one of the nurses told us was that some incubators had been donated from the US and given to Malago, but they hadn't been used because you needed to purchase an electric converter, and Malago just didn't have the money to be purchasing these converters one at a time to make them work. So I think that's one issue that I just didn't foresee at all, and you could probably manage that service and support a lot more effectively.
we saw a lot of people who were very capable and willing to learn, but just had no motivation and no inspiration. And so I think management science can really provide that kind of incentive system where people do feel like if they work harder, there are huge upsides to their efforts.
After we had spent all of this time collecting data, we sat down and tried to figure out what we had. We took a good look at the data and realized that we actually had some solid advice to give them in operations, finance, IT, and marketing. Through this, we developed a great respect for Dr. David and Samuel. Their clinic had grown immensely over the past 3 to 4 years, and we admired their ambition. We were so inspired by what they had achieved that we wanted to repay them by inspiring them to push forward.
Wow, it's amazing. I'm seeing quite a lot that I can do. You presented it, you've made suggestions that are quite practical for us. You know, there's nothing really that seemed to me, it's a huge task. Everything is doable here.
Yeah, that's
it's
great.
just getting down and planning and getting to know what our priorities are. You've just spelled out what, the goal we should focus on, that positioning. It's just building around that
So I think that management science can help.
Oh, thank God! You guys just
Edit.
I was graded.
That's perfect.
Throughout the entire swamp period, I was in good spirits. I was jolly and being friendly and trying not to be. And then the minute we were on stable ground, hallelujah, that is when I got annoyed as hell, because it was an hour of swamp walking, not like 10, 15 minutes. Anne got up to her thigh.
I was really scared.
And I got up to my knee. And Irina is all dainty.
There's a wheelbarrow. No, come back here.
Well, I get wound up tiring of golf balls. So if I get going too fast, tell me to stop.
Can we please, for the love of God, turn on the air conditioning? Yes, look at the transformation.
Survival trousers to survival shorts. So what's the most interesting thing I've learned in the past 2 days? I would say